The forms they'll be filling out are the basic ones, first, last name, date of birth, address, how they refer to Dr. Giletti, insurance information if they'll be using any.
The room is where they'll have like a consultation with Dr. Giletti for about 30 minutes, discuss like past medical history, if they've been in the fertility before, if they've been through any of the process of the fertility, and if they've tried any fertility medications. And then depending on how that goes, he'll take them to the other side. We'll have them empty their bladder, of course. That's how we get a better image of the uterus. And then we'll take them into the room. We'll do a baseline ultrasound image just because everybody's uterus is obviously different. So we'll have a baseline image, and then from there we'll decide what we're gonna do for the treatment.
The idea is to give them an idea of what the problems might be, what the testing is going to be looking like usually over the course of the cycle or the month, and what the outcomes potentially could be. So one of the things that I like to talk about, especially at the first visit, is the overall prognosis or chance of getting pregnant in general, because people really are concerned that there's a big problem and that they might not be able to get pregnant. And I like to kind of assess that right off the bat. So for example, based on a patient's apparent problem and their age and what's available to help them, give them an idea of what the true chance of pregnancy is.
Dr. Giletti kind of created a calendar. He has like a calendar printout, and he tells you which days to start different medications, and kind of goes through the process in chunks that way, as opposed to like knowing exactly what's gonna happen from start to finish up front. And I think that was helpful because it made it a little less overwhelming.
The whole facility was very welcoming, and every time, we came, they were just very helpful. Any questions we had, we could call them or text them and, ask if we, were worried about the medication, because we had to do this whole process before the implantation. So they were very just helpful.
We're big on patient education. I think that it's a part of our job. We have to inform them. Dr. Giletti informs the science part of it, and we're coming here to do the straight facts and kind of just show you how to do things, why you're doing it. Even though we are just the medical assistants, we have enough knowledge Dr. Giletti has blessed us with to be able to comfortably go in that room, and this is why we're doing it. This is why he wants it. And I think patient education is so important to us.